In the latest Joe Rogan related controversy, the Spotify podcast host spread misinformation, unfortunately, regarding whether young people should get the vaccine. Here's what he had to say.
And people say, do you think it's safe to get vaccinated? I've said, yeah, I think for the most part, it's safe to get vaccinated. I do. But if you're like 21 years old and you say to me, should I get vaccinated? I go, no.
Yeah.
Are you healthy? Are you a healthy person? Like, look, don't do anything stupid, but you should take care of yourself. You should, if you're a healthy person and you're exercising all the time and you're young and you're eating well, and like, I don't think you need to worry about this.
Yeah, I tend to agree with you.
But there's a lot of jobs that will tell you you need to have this.
Well, that's what's starting to happen now.
People are worried about them doing it for their children. And we talked about this earlier. Yeah. There's that you might have to have your children vaccinated. And, you know, I can tell you as someone who's both my children got the virus, it was nothing. I mean, I hate to say that. If someone's children died from this, I'm very sorry that happened. I'm not in any way diminishing that, but I'm saying the personal experience that my children had with COVID was nothing.
Now that has led to a wave of backlash. People are furious about it, but I want us to just take a deep breath and see this as an opportunity, a learning opportunity, and that's exactly what we're gonna do right now. Unfortunately though, we're going to have to take a trip to a very special place that we're gonna go to quite often on this show. And it's a place where we go when influential people say damaging things with unearned confidence. We're gonna take a trip to the debunker.
You didn't see Republicans, when we had control of the Senate, try to rig the game.
Shows how the Green New Deal would be a deadly deal for the United States of America.
Our systems are not racist.
All right, we're now officially in the debunker. And John Iadarola, I'm gonna open this up to you first because you have done a great job covering the coronavirus.
I've tried.
And you also seem to have a pretty firm grasp of why it's important for young and healthy people to also get vaccinated. So why don't you respond to Rogan's claims there?
Yeah, I think that I have a firm grasp, but to be fair, I did cheat. You know, rather than doing what you're supposed to do with this sort of job is just make it up as you want. I listen to the people who actually know. Doctors, you know, not doctors of suplexology or anything, but doctors of like epidemics and stuff. And so there were a couple of things that bothered me about what he said. One, just as a general thing, and this is for both on-air personalities and everyone, you can't just say, I don't mean to diminish that. You have to actually not diminish it. When you say, sure, some people's kids died, but mine were fine, so other people shouldn't vaccinate their kids, that does diminish it, even if you say, I don't mean to diminish it. So it's like a show versus tell sort of thing, so bear that in mind. But yeah, I think that it's amazing in a segment where he is giving medical advice that he's not qualified to do, in the same way that I'm not qualified to tell you what to do if you end up on the ground in a crossbody armbar. I don't know the correct way to break out of that, so I don't opine on it. He says if you're healthy, if you eat right, if you exercise a lot. I've never heard any indication that either of those things particularly affront the coronavirus. It's like I was gonna infect her, but it turned out she had kale recently. None of those have anything to do with it. He also says, don't do anything stupid. It's good advice for all sorts of people. Don't do something stupid. If you're gonna tell people to do something that could have negative side effects, even if you think there's a low chance of it, then at least balance the scales by telling me what you get out of not doing it. So he's saying, maybe there could be something. Okay, what's the upside of not doing it? So you potentially get coronavirus. What do you get other than that? So then why are you not getting it? It's freaking free. We're in America, we're being offered free medicine for once and you're telling people not to take it?
Yeah.
At least put up a fig leaf of the benefit that would come from that, but he doesn't even try because it doesn't exist.
You know, one of the things that I think the media could have done a better job in was actually exploring the development of the coronavirus vaccine, because I think a lot of people are under the impression that this vaccine was just like cooked up in a hurry in a lab as soon as we figured out the coronavirus was gonna be a problem, but that's actually not the case.
Yes.
The framework for both the Pfizer and Moderna vaccine, the mRNA framework, was developed in universities and had been worked on for a very long time, but was languishing essentially. And it was through programs like, yes, Operation Warp Speed, that took that university research on that framework and was able to develop it to the point where it's highly effective in protecting us against the coronavirus. So I get why some people who might not know that, might not know the history of that, would be hesitant. But at this point, we're talking about, hundreds of millions of Americans who have at least gotten the first shot. And we're doing okay.
No,
we're
I
doing
am legend.
great. I mean, it's just
nothing.
And even when there are some complications, as there were with the J&J vaccine, 6 people got blood clots, and they immediately halted the use of that vaccine until they could provide more studies and ensure that they talk to healthcare providers and let them know how to treat this form of blood clots. I mean, it's more evidence to how, shockingly, the vaccine rollout has been pretty remarkable, really. I mean, the United States has one foible after the next in responding to coronavirus. But in terms of the rollout of the vaccine, especially under the Biden administration, it's been impressive to say the least.
Yeah.
Now let's talk about why young, healthy people also need to get the vaccine. The virus mutates. There are already countless mutations of the virus out there. And one of these mutations that we know of so far has proven to be far more dangerous to people of all age groups, but in particular young people who are thought to be indestructible, young people who are thought to be pretty immune to the virus. Maybe they get the virus, but they're asymptomatic. I mean, that was the original thinking. But because of these mutations, we're now finding a completely different animal to deal with. And so I take you to Michigan, where some new numbers regarding coronavirus cases will hopefully get people like Joe Rogan to kind of rethink his talking points on the vaccine. Michigan's COVID wards are filling up with younger patients. Even as vaccines roll out, more younger people in Michigan are being hospitalized than at any other point in the pandemic, and they're coming in sicker. So again, the vaccine is important because we need herd immunity. Herd immunity will prevent further mutations, and the mutations are always far more brutal than the previous iteration of the virus. And by the way, you want herd immunity through vaccination, not herd immunity by doing absolutely nothing and just seeing all these people get sick and die, which was the Trump administration's policy. We now have a vaccine, let's encourage people to take it. Michigan hospitals are now admitting about twice as many coronavirus patients in their 30s and 40s as they were during the fall peak, according to the Michigan Health and Hospital Association. One nurse said, every time we get a call or every time we hear there's another 40-year-old that we don't have a circuit for, it's like, we can't save them all. So there are young people dying because some of these hospitals, like in Michigan, are overwhelmed with young patients being admitted. One doctor says this, I am putting more patients in their 20s and 30s and 40s on oxygen and on life support than at any other time in this pandemic. And just to give you further details about the mutation that I'm speaking of here, public health experts, according to the New York Times, say the outbreak driven by the B.1.1.7 variant of the virus, which is more contagious and more severe, is spreading rapidly in younger age groups. The B.1.1.7 variant, first identified in Britain and now the most common source of new infection in the United States, is believed to be about 60% more contagious and 67% more deadly than the original form of the coronavirus. So I just think that ever so often, Joe Rogan will have a guest who actually will just simply tell it like it is. And Bill Burr happened to be one of them. Just want to remind you, Joe, of what Bill Burr told you when you tried to strike up a conversation about coronavirus.
Walk down the street with a mask on?
Let's not start this, Joe.
Do you though?
Let's not start this. Okay.
Let's start it.
I don't want to start this bullshit I'm not going to sit here with no medical degree, listening to you with no medical degree, with an American flag behind you, smoking a cigar, acting like we know what's up better than the CDC.
Sounds like really good advice. He should have listened to Bill Burr.
Yeah, that was pretty good.
Yeah.
Yeah.
Hey everyone, as you all know, coronavirus has been pretty devastating for people's personal finances. The inaction in Congress, or the very little relief that was provided by Congress, unfortunately didn't do much to help small businesses that were really, really hurt by being forced to shut down in order to slow the spread of coronavirus. There are 100,000 small businesses that have been closed since the pandemic began. Some of you might feel helpless, but luckily there's this wonderful initiative known as the COVID Rescue Fund. So all you need to do is go to covidrescuefund.org and you'll learn more about how you can donate or how you can vote and promote your favorite small business. And really the whole point here is to offer generous grants to help these small businesses. The COVID Rescue Fund crowdsources up to $100,000 for each individual grant. So we're not talking about a small amount of money. You know, I've seen small businesses in my community shut down, and these are small businesses where I had relationships with the owners, and to watch them lose everything that they've worked so hard for has been absolutely heartbreaking. I really wanted to do something then, and I'm happy to see that there's an initiative that could help people get involved now. Go to covidrescuefund.org and donate. Let's come together and bring back as many small businesses as possible.